So I usually work with adults, especially adults who are experiencing issues with mood, anxiety, trauma, racial trauma, and stress. I also work with adults experiencing difficulties coping with chronic pain. And then the last population that I'd say would be couples who are looking to improve their communication, who are navigating a uniquely difficult time, who are looking to improve their intimacy, and who are currently in an interracial relationship. Hi, so my name is Tolu Lola Taiwo Hannah, or Tolu. I use she, her pronouns, and I'm a social worker and psychotherapist with Hope Leads Mental Health Care. So an individual or a couple can expect a supportive and non-judgmental space in working with me, where they'll be able to explore the role of emotions, deepen their self-knowledge, and hopefully bolster their coping skills to be able to cope with the difficulties that come through life. They can also expect to be challenged a little bit while being met with warmth, care, and humor. So I'd say the overall approach is more client-centered, but some of the tools that I use to be able to ensure that that's the case are a combination of some of the cognitive traditions, so that would include things such as cognitive behavioral therapy and cognitive processing therapy, but then I also use emotion-focused therapy, and where relevant, maybe borrowing from things such as DBT skills. For those who identify as spiritual, come from more of a faith-based or religious background, I also use spiritually integrated psychotherapy. And for me, what that looks like is it's beyond just using spirituality as a set of tools, but rather as a full way of seeing one's self and full personhood, spirit, soul, and body. And I provide all of this using more anti-oppressive and trauma-informed lens. Lastly, I also believe that we heal in community, and I'd love to be a part of your community. To reach me, you can look at our website, which is www.hopeleads.ca, or send me an email at info.hopeleads.ca.